Morning, Dr. Jennifer Venditti and I. My name is Marimani Hausnick. I'm the Director of Admission at Commonwealth University Bloomsburg. Just full disclosure, this is being recorded so we can post it on our website for other students to learn about our medical imaging program. And we're just going to give it about 1 more minute to see if we have any other students or attendees joining us tonight, and then we will get started. And thank you again for joining us this evening. And there will be an opportunity during the session while Dr. Venditti and I are presenting to put questions in the chat or in the Q&A. Okay, well, Dr. Venditti, I think we are good to start. If we have any other folks joining us, that will be great. Otherwise, we will get started for the sake of everyone's time. Let me just bring up our PowerPoint. And if you want to go ahead and introduce yourself while I'm doing that, that would be great.
Greetings and welcome everyone to our medical imaging session. My name is Dr. Venditti. I am a professor in the Department of Biological and Health Sciences, and I am also the program coordinator for our medical imaging degree program. I am excited to be here tonight to talk to you about this program. If we think about what is medical imaging, this is a really fascinating field. There's been a lot of growth. It's constantly changing. This is a field that uses a variety of different types of technologies that can be used to acquire images for screening, for diagnosis, for treatment of a variety of conditions. Medical imagers are really important members of the healthcare team because the images that these professionals acquire are a really critical piece of evidence that can be used for clinical decision making. Providers can extract a variety of information from images about anatomy and physiology that can then be used to develop the best course of action for their patient. Some examples of medical imaging modalities include X-ray, CT, MRI, which is magnetic resonance imaging, ultrasound, and there are lots of others as well.
Get through there we go. Sorry about that.
If you come to Commonwealth University Bloomsburg as a medical imaging major, here are some of the courses that you would expect to take. All medical imaging majors start out in Principles of Biology 1. This is a lecture and laboratory course. It's a 4-credit course that I teach. So you have lecture 3 days a week with me for 50 minutes each lecture. And then you have 1 3-hour laboratory session each week. So your very first semester, you'll see me in Principles of Biology 1. Other courses that you should expect to take is an anatomy and physiology sequence. So you'll do A&P 1 and 2. These courses are critically important for when you get to your clinical program because medical imaging really is all about anatomy and physiology. You'll take a medical terminology course. You'll do some math. This is an algebra-based course. You'll learn about physics. This is also really important for all of the different technologies that are used in medical imaging. You'll learn about medical ethics and how to utilize and analyze spreadsheets, because in healthcare, you have to be really good and really organized about all of the information that you are collecting. So this is just some of the courses that you should expect to take. In addition to these courses, you'll also be required to complete all of the general education requirements that we have at our institution. There are two different pathways for our medical imaging program. And I like to describe them as our 2+2, which if you look on our website under our degree maps, you'll see is called the long clinical option, and then our short clinical option. For the long clinical, or what I like to call the 2+2, you would be at Commonwealth University Bloomsburg for your first 2 years, completing all of your core degree requirements, which will align with the prerequisites that are required for clinical programs. You'll be completing all of your general education requirements. And then for your last about 2 years, you will attend an accredited hospital-based certificate program that is full-time and is at least 22 months in length. And I always like to point out that once you enter your clinical program, it is a full-time commitment. So these programs are at least 22 months in length. So they range typically between 22 and 24, 25 months, and they go all year round. So fall, spring, summer, fall, spring, summer. And then upon successful completion of your clinical program, those clinical credits can come back to Commonwealth University Bloomsburg and can be used to satisfy the last part of your degree requirements. The other pathway is what I call our short clinical option. And the difference here is that you will be at Commonwealth University Bloomsburg for your first 2 to 3 years. You're still doing the same thing that the students in the long clinical option are doing. You're completing all of your core degree requirements. You're completing all of your general education requirements. But because in the end, you'll be attending a shorter clinical program, there's an extra set of courses called a science emphasis area that you need to complete prior to starting your clinical program. The clinical programs that are associated with the short clinical option are about 12 to 18 months in length. And these tend to be your sonography, your nuclear medicine technology, and your CVT or your cardiovascular interventional technology programs. I'll back up for just a second. The long clinical programs, these tend to be your radiography programs. So if you're thinking about doing x-rays, okay, or radiography, you will likely follow our long clinical option pathway. If you're thinking about sonography or nuclear medicine technology, you will likely be following our short clinical pathway. All students are required to apply to clinical programs, and you should apply to at least 5 accredited clinical programs in the fall semester of either your sophomore or your junior year, which means if you're following that long clinical option, you will apply the fall of your sophomore year. So the 3rd semester that you are at Commonwealth University Bloomsburg, you will be applying to your clinical programs. Okay, if you're in the short clinical pathway, you have a little more time to apply to your clinical programs. Every fall semester, I host an application seminar for all of our medical imaging students where I explain the process of how to apply to clinical programs, what type of application material is typically required. We review the prerequisites, and I have a colleague from our financial aid office come and talk as well about how financial aid will work during your clinical program experience. It's really important to know that acceptance to a clinical program is not automatic. It's not guaranteed. It is the student's responsibility to apply to the at least 5 clinical programs, but our acceptance rate into clinical programs is really good. It's over 90%. What will help you be successful when you apply to clinical programs is applying to at least 5. So the more hats you put your name in, the more likely you are to get accepted. And really focusing on doing well in your courses right from the start. A's and B's are the grades that you want to be earning in your core courses. Okay, clinical programs are competitive, so you really want to put your best foot forward. I'd also like to point out that we don't offer the clinical requirement part of the degree at Commonwealth University Bloomsburg. So when it comes time for you to do the clinical requirement, you will be going somewhere other than Commonwealth University Bloomsburg. And in a few slides or two, I'll give you some examples of clinical programs that our students typically attend. So here they are. So this is not just a short list of examples of programs that Commonwealth University Bloomsburg students are routinely accepted into, and some of these programs are our clinical affiliates. So Geisinger School of Radiologic Technology is always a really popular choice. So if you're thinking about X-ray, you can apply to Geisinger's program. If we think about sonography or nuclear medicine technology, some of the other modalities, Johns Hopkins Schools of Medical Imaging actually has 3 different programs, and all of them fall under what I described as our short clinical option. So Hopkins has radiography, they have sonography, and they also have dual certification in nuclear medicine technology and CT. South Hill School of Business, another one of our affiliates, has a sonography program as well. There are 2 websites on this slide that I share with all of our medical imaging students. If you're curious about what types of certificate programs are out there and available for you to apply to, you could visit either the JR Cert website, and there you can find accredited radiography programs, or you could visit the KHEP website. And on that site, you could find some accredited sonography programs. And there are lots of different types of search filters that you can use. So when you go to these programs, you want to look for accredited certificate programs, and these are going to be hospital-based. So you're not necessarily going to another college or university for your clinical program, but you're going to go to a hospital to complete your clinical program, because that hospital has an accredited program with one of these accrediting agencies. And you can sort by geographic location. So if you want to see if there are any clinical programs that might be close to home for you, you can certainly do that. There are lots of different pathways in the medical imaging field. It's always changing as new technology is developing. If you take a look at this slide, you'll see a list of some of the career options and pathways that you can choose. The nice thing about medical imaging is that once you've learned and you've become certified in a baseline modality, there are opportunities for you to go on and become certified in additional modalities. For example, oftentimes we'll have students who are interested in radiation therapy. You could come to Commonwealth University Bloomsburg. You could follow our long clinical pathway. You can go to a radiography clinical program, become a certified radiographer, and then go on and become certified in radiation therapy. So that's just one way to get there. Maybe you decide you want to do RT as your baseline modality and then go on and earn some additional certifications. So there are opportunities for growth. Something that I'll also point out about our program is that it is a bachelor's degree. And earning the bachelor's degree right from the beginning can open doors for you in the future. If you're thinking about becoming a program director or a clinical instructor, many times those types of positions require a bachelor's degree. Maybe in the future, you'll want to go on to a graduate program. In order to do that, you'll need to have earned a bachelor's degree. So that's something that's really great about our program, is that you can earn the bachelor's degree right from the beginning of your career.
Looks like I'm up next, but Dr. Venditti, is there anything else before we turn it over to my couple of slides and open it up for questions that you want to share with the group?
I think I'm good for now. I'll just wait and see what questions we have.
Okay, so for those of you joining us, I only have a couple of slides to go over some of the admissions process. Some of you have already applied. Some of you have actually been admitted for fall of 26, which is great. We've even had one student already commit to attend for next year, which is really exciting. And so for those of you who maybe have not applied yet to Commonwealth Bloomsburg, medical imaging is only for first-year students unless an external transfer student may have certain credentials to potentially apply, but it is predominantly for first-year students. We typically have a cohort, meaning a class of about 60 students each fall. If you have visited campus, we will waive your application fee. You just go to commonwealthu.edu. There's an apply now button right on the main website, and I'll drop that in the chat here in a moment. And that'll waive your fee if you visit campus as well. We do not accept the common application, which is a national application that lots of colleges and universities will accept, but we are not on that application. So you do want to go on to the Commonwealth University website and fill out our application. It's much shorter than the common app. It has all the pertinent information that we need to know about you. So you don't have to go through pages of an application. We are test optional for 2026. So what does that mean? We do not require the SAT or the ACTs. However, if you do submit your test scores, we're going to assume you want us to review those test scores, and we will consider them in an admission review for medical imaging. So just, some caution that if, you have a certain test score and you're concerned about your test score, you may want to call and talk to our office first regarding, whether or not you should submit those test scores. Overall, on your high school transcript, we're reviewing your classes from 9th grade through 11th grade. We're going to look at your overall GPA. We traditionally want to see around a 3.5 or higher GPA for consideration, not necessarily guarantee of a seat. And we also will look a little harder at your math and science preparation. I'm not saying that every student has to have all the chemistries and physics and what have you, but we are looking at level of courses that you've taken, what types of science courses, how are you prepared for the next step with this particular program? We typically have anywhere from about 175 to about 200 students who apply. We're typically admitting roughly 100 of those students to fill the 60 seats. So again, competitive in terms of how many students we're reviewing and how many we can bring in. If you complete your application, meaning you apply and submit your high school transcript by the December 15th deadline, that will put you into consideration for academic scholarships as well. And so as we're starting to admit students within the next few weeks, we will also start to review students for potential scholarship. And then just an idea, so especially whether you're in state or out of state, to give you an idea of what does college cost. So when you're looking at colleges, you want to consider cost of attendance. So the slide that you're seeing here, if you're an in-state student or out of state, is for the academic year, fall and spring. It's not per semester. The difference for our out-of-state students would be in tuition and fees, and then housing and meal plans would depend on what the student's choosing or where they're housed for that and what meal plan they choose. The higher the meal plan, the more money that costs. The lower the meal plan, the lower your cost may be. But this is just strictly, what does it mean to be a Commonwealth Bloomsburg student? This does not take into account average financial aid that a student may receive. So when you and your supporters, starting hopefully October 1st, the free application for federal student aid, the FAFSA form, should be available for you and your families to fill out. That is the free form that all colleges and universities will use to determine what type of financial need do you have. Are you eligible for any federal, state, if you're an in-state student, grant monies? Any student who files a FAFSA form can take out a federal student loan, including for their supporters. It's called a Parent Plus loan. So even if you think you may not qualify for need-based aid, I strongly encourage students to file, because life happens. You may have a change in income. You could have a life kind of altering experience where maybe your income is affected in a good or a bad way, but we want to make sure that you have your FAFSA on file so our financial aid team can then help and determine if there is any aid available for a student. But this also gives you a comparison of colleges depending on who you may be looking at. So state-related, private schools, selective private, you can see the cost increases depending on the type of institution. So as you start to receive your financial aid award letters from colleges, which typically doesn't happen until early spring, once colleges have your FAFSA information, that's when you want to really start comparing cost. What is the cost to attend minus the financial aid you would be receiving? So as an example, if you're an in-state student and right now to be a full-time student, to live on campus, have a meal plan, go to class full-time, It's a little over $23,000 for the year. Let's say you receive a $4,000 in-state scholarship. Well, you're already taking $4,000 off of that cost of attendance without any consideration of any other kinds of financial aid. Excuse me. So that's how you want to look at cost of attendance at a college and then compare your actual financial aid awards when you get to that point. Just a word of a caveat for our medical imaging students, depending on clinical site and where you go, your scholarship may not follow you to your clinical site. It is once you, as you're attending Commonwealth University, and I'll ask Dr. Venditti to elaborate there if need be as well. And also you would not be living on campus. So if you start living on campus your first 2 years or third year, if you're staying for that particular length of time, you can live on campus. But once you're at a clinical site, you would not be eligible to live on campus at that point. So just wanted to have some disclosure there for that kind of information. Sometimes students are not expecting that change in their academic pace and when they're ready for clinicals. Because especially if you're potentially going clinicals back home, as Dr. Venditti mentioned, it wouldn't make sense for a student to then pay and live at the university. So now we can open it up, excuse me, so sorry, for Q&A. I'm going to stop sharing my screen. I will put my email and Dr. Venditti's email in the chat, but feel free. If you have questions now, you can put them in the chat. You can put them in the Q&A. You can certainly email us at a later time if you're not sure even what to ask at this point. But we will open the floor. And Dr. Venditti, I don't know if you want to speak a little more to the scholarship or financial aid piece of medical imaging.
Oftentimes there are questions about financial aid and tuition and scholarships when it comes time for the clinical requirement of the degree. What will happen is before you go to clinical, I will give you a packet of papers that you will fill out. So in the spring semester, let me back up a step. In the spring semester, I will host with my colleague from our financial aid office who works very specifically with our medical imaging students. I will host a clinical session where we will discuss the details of how financial aid works and how scholarships will work. Once we have that session, I will give you a packet of paperwork that you will complete. And then once it's completed, you'll sign up to meet with me and we will sit down. We will go through all of the paperwork together. And once I know that you have everything in order and we are cleared for takeoff, all of your degree requirements have been met with the exception of the clinical requirement, I will clear you for clinical. One of the pieces of paper that you will complete in that packet is called a program scheduling form. And what that form does is it tells us the name of the clinical program that you are attending, the dates that you are going to be there, and how many clinical credits that will equate to once you are finished. Once I review that form and sign off, I then send it to my colleague in our financial aid office who develops what's called a consortium agreement, which is essentially an agreement between Commonwealth University Bloomsburg and your clinical site. Let's say, for example, you're going to Johns Hopkins Schools of Medical Imaging for ultrasound. I'll send your form over to financial aid. Financial aid will develop a consortium agreement that is specific to you. So every student gets their own consortium agreement specific to you between Commonwealth and Hopkins. You're still going to fill out your FAFSA as you would if you were still attending Commonwealth University, because what that consortium agreement will allow Commonwealth University to do is to process financial aid for you. When you are in clinical, because you're not taking courses at Commonwealth University, but rather you are at the hospital completing their clinical program, you are going to pay tuition and fees directly to your clinical program at the rate that the clinical program determines. So every clinical program is going to have a different rate. It's just like shopping for college. So just like the bar graph that Mayor Monty just shared a few moments ago about comparing costs, you should also compare the cost of your clinical programs. So if all of your clinical programs have a 100% pass rate on their board exam, but they vary in price between $10,000 and $25,000, you want to make sure that you're factoring in cost as well. So what will happen is Commonwealth University can process financial aid because you're not getting a bill from Commonwealth University, because if you're not enrolled in our coursework, you won't get a bill from us. The financial aid gets applied to your account. It will come as a refund if you have a $0 balance with us. And then that financial aid money is then utilized to directly pay your clinical program. All of our medical imaging students get a handbook, a medical imaging financial aid handbook from our from our financial aid office that we review step by step during this meeting that I talked about that I host in the spring semesters. And you will get a copy of that electronically as well so that you always have it as a reference. As Marimani mentioned previously, any scholarships that you have that start with you at Commonwealth University will generally not apply during your clinical program. Okay, so you should just factor in that your scholarships are not going to apply. There are very, very few exceptions to that. Sometimes it'll be applied, but at a let's say discounted rate or a lowered rate. But I always tell students, just plan as though those scholarships will not apply.
Thank you, Dr. Menditti. That was
Sure.
really thorough. Appreciate that. We do have a question in the Q&A.
Yes.
A student posted, I'm concerned that Bloomsburg is not accredited school for sonography. How does that affect me at graduation? When I graduate, can I say on a job application that I went to an accredited school since the clinical at the hospital is accredited?
Yes. Because we don't offer the clinical component of the degree at Commonwealth University Bloomsburg, we do not have to be accredited by one of the medical imaging agencies. So the two websites that I mentioned earlier, the JR CERT and KHEP. So those are accrediting agencies for radiography and sonography. And there are some other accrediting agencies as well for some of the other modalities. But because we're not offering the clinical component of the degree, we don't have to hold those accreditations. But as part of your degree, you are required to attend an accredited clinical program. And by attending an accredited clinical program upon successful completion and earning your degree, you will be able to take the board exam to become licensed and become a registered medical imager. So you don't have to worry about Commonwealth University Bloomsburg not having an accreditation, because the clinical program that you complete will be accredited, and that's what's important for your board exam. That's a good question.
Thank you very much, Dr. Menditti. I don't see any other questions at the moment. I did place in the chat not only our email addresses for everyone, but also a link to the medical imaging website, especially if you'd like to see, as Dr. Menditti was speaking to what types of courses you'll take, there's a curriculum sheet on the website that you can utilize. And then also the two websites for the accredited clinical sites that Dr. Menditti mentioned, I also put in the chat for you all to use as well.
Other questions? Don't be shy.
And you will not be alone in the process. Dr. Venditti, she and I have worked together for a long time. And while I'm not on the faculty side or in the academics, since I'm in admissions, and my son has actually taken Dr. Venditti's class in biology. He's a biochemistry major, but I can say that you will be in very good hands. You will certainly get great guidance and advising to help you take the next steps. It's a faster paced, if you will, than what a traditional four-year degree may look like because of the clinical aspect. And so sometimes students have concerns about what that means in terms of advisement or getting what they need. And you will get those things with Dr. Menditti and within the department.
We have a lot of resources to help you succeed. We've had the medical imaging program for a very long time at our institution, and we're pretty good at it. Our students are very successful. Most of them are securing employment before they even finish their clinical programs. You will have me as a resource as the program coordinator. You'll all see me your very first semester in your biology course, where we'll have lots of fun. And then you will each have a dedicated academic advisor who is a faculty member in my department who specializes in advising medical imaging students. So you have a lot of resources to help you succeed. That's why I'm here. That's why we're all here, because we want you to be successful. There was something else I was going to say and I lost my train of thought.
Well, we do have another question. If you
Oh,
think of
good.
it, we can come back to it.
Yes, that might help.
And I think it might help students who are in the chat. So I'm going to ask the question to the group for you. Is it possible to attend Bloomsburg undecided and then transfer into medical imaging?
That's a good question that doesn't have a very, I'm going to say, clear-cut answer. As Marimani mentioned previously, we can only accept a limited number of students into the major. 60 is our max every fall, and this is typically a fall start program. The only way we can accept what I like to call an internal transfer student, and that would be a student who comes as a first-year student to Commonwealth University Bloomsburg as exploratory or undecided, could potentially pursue what I call our internal transfer pathway, whereby you would come and meet with me. We would talk about your interest in the program. I would put you into my biology course to see how you do. And if you do well and a seat opens up in the program, then you could be considered. Unfortunately, our internal transfer process has not been opened recently because we just haven't had any room in the program. And the reason we limit the number of students in this program is because there are a limited number of seats in clinical programs. If there are only 80 seats in a clinical program and we accept 100 students and we know that all 100 students are going to need a clinical seat at exactly the same time, that's not very good math on my part. So we intentionally limit the number of students in the program because we need to make sure there are enough clinical seats, because without completing the clinical requirements, you can't complete the degree. So sometimes, I will say sometimes it's possible, but it unfortunately hasn't been possible recently.
Thank you, Dr. Venditti. I
Sure.
don't see any other questions for now. Anyone have any additional questions? I will say, for those who maybe have not, for fall 2026, that semester, if you have not applied yet and you're currently going to be a high school senior, you really do want to get that application and your transcript in sooner than later. Our preferred deadline is November 15th. However, it's not uncommon for the program to potentially already be at capacity around that time or right around Thanksgiving. So you don't want to drag your feet and not apply until November, because we have so few spots to offer students. And so if you're, after tonight, if you talk about it with your families or your supporters and decide if you have not applied yet or haven't finished your application, you want to go ahead and do both of those things so that we can then get you reviewed. Because once we reach the number of students we can accept, we will start to wait list students. And there's not a guarantee, unfortunately, that we may move students from that wait list, because traditionally, most students who apply to a program like this and commit are usually locked in to that particular program. We might lose one or two here and there to another major, but it's pretty rare as an incoming student. So again, I do not recommend that you wait until November or later to apply, because we very well may be filled by that point.
Absolutely. Thank you for making that point. It is really important that you apply as soon as you know you are interested in this major, because we don't want you to not get in simply because you waited until the last minute to apply and it's already full.
Okay, well, I don't see any other questions, Dr. Venditti, in either the chat or the Q&A. I think if we don't have any other questions, I think this is a good place to stop. As I mentioned to the group, we will share this video probably within the next couple of weeks. We just have to do a little editing at the beginning before the session started, and it will get posted onto the medical imaging webpage for reference. But feel free to stay in touch with Dr. Venditti or myself and certainly help you through the admissions process. Dr. Venditti is the expert in the field, as you learned this evening, so she will be able to answer questions more programmatically about the program, and I'm certainly there to help support you through the admissions process. So I want to thank everyone for joining us this evening. Dr. Venditti, thank you so much for your time, and I hope everyone has a great evening.